Hello, my name is Idiana Dugar Alvarado. My topic, Veliparib Wing Freeze Line, Chemotherapy, and as my nice therapy in ovarian cancer. Definition, ovarian cancer. Cancer that forms in tissues of the ovary, one of a part of male reproductive gland in which the ova or egg are formed. Most ovarian cancers are ovarian epithelial cancers deep in the cells on the surface of the ovary, or malignant hair cells. Tumor cancers can begin in egg cells, fallopian tube cancers, and primary peritoneal cancers are similar to ovarian epithelial cancers and are stained and treated the same way.
The ovaries are the female reproductive glands. They consist of three types of cells: epithelial, germ, and stromal. When the cells in the ovaries grow abnormally, they develop into tumors that can be non-cancerous or cancerous. If cancerous tumors are not detected early, the cancer cells can spread from the ovaries throughout the pelvic region and continue to spread to the abdominal area and other organs. Determining the stage of ovarian cancer is very important in developing a treatment plan. At stage 1, cancer is limited to one or both of the ovaries. In stage 2, ovarian cancer extends to the pelvis area. In stage 3, ovarian cancer has spread to the abdominal region. In stage 4, ovarian cancer extends into the liver, or to locations beyond the abdominal area. Ovarian cancer treatment typically includes surgery, chemotherapy, radiation therapy, or a combination of therapies.
Application in use. Women at least 28 years of age will have received an initial histological diagnosis of high-grade serous epithelial ovarian, fallopian tube, or primary peritoneal carcinoma of International Federation of Gynecology and Obstetrics stage 3 or 4 were included in the trial.
So, in regards to signs and symptoms of ovarian cancer, the challenge is that they're not very specific. So, unfortunately, sometimes it takes a while before the patient gets the appropriate imaging to evaluate the ovarian cancer. Typically, patients will have this acute onset of bloating. They realize, oh, this doesn't feel normal. And then it's persistent and it typically doesn't go away. They may have troubles with urinating, having bowel movements, even though their pants are getting tighter because of the abdominal distension and the bloating. their weight continues to drop because they're unable to eat very much. They get nauseous after eating small meals. But typically what happens is a patient presents to their primary care doctor because the symptoms are so not specific, and that's why they end up getting, the GI workup, and then they still have the symptoms, and then they warrant further imaging. We see patients all the time that come in and say, I kept going back to my doctor. I kept going back to my doctor. They told me nothing was wrong. It's always important that you're comfortable with your treatment plan, and it's always good to get a second opinion. Unfortunately, in ovarian cancer, there's no good screening test to improve outcomes or improve survival. So patients that have a family history, the most important thing that they can do is make sure that they have genetic testing, and then their follow-up is based on the results of their genetic testing. We do that here. We have a whole clinical genetics department that, they see all of our patients, and all patients that actually have a diagnosis of ovarian cancer, it is recommended that they have genetic testing as well. There's a lot of research going on to, try to figure out is there a tumor marker? Is there something like a PSA? Is there something screening ovarian cancer? But we just haven't been able to find that yet. And so kind of what I tell patients is, you know your body best. So you have to make sure you're an advocate. If you feel like something's not right, you have to say something's not right. I need this evaluated. You know your body better than anybody else. Knowing that the symptoms are not very specific, making sure that you really have a good understanding of your family history, because that can be important in your risk, and just watching out. And if anything's not right, just making sure that you reach out to your physicians to let them know.
Pros and cons. Pros. He makes plan to have his children before he 13. She makes sure to process her high. She makes this time she have to help find 35 and after my have on to 1 or 2 pregnancies and breastfeeding her babies. She makes the city to win until 14. Cons. Bone thinning increased rate of her disease. This force on menopause.
Ovarian cancer is a subtle disease. It can sneak up on us like a thief in the night, disguised as common problems such as prolonged bloating, the constant need to pee, and fatigue. While the warnings are the same, the most common type of ovarian cancer begins in epithelial cells, a type of cell that makes up the tissue covering the ovary surface. To best treat ovarian cancer, doctors at Roswell Park first confirm the diagnosis and learn the stage or extent of the cancer. This requires a procedure called surgical staging, during which a surgeon carefully examines your pelvic and abdominal areas. The stage of ovarian cancer is determined by where cancer cells are found in the body. In stage 1, ovarian cancer is found in or on the surface of one or both ovaries or fallopian tubes, or in fluid collected from the abdomen. In stage 2, the cancer has spread from its initial site to other areas of the pelvis, such as the ovaries, fallopian tubes, and the uterus. Finding cancer only in the lining of the abdomen is also considered stage 2. Stage 3 means that the cancer has spread outside the pelvis and is found in other parts of the abdomen, nearby lymph nodes, or on the surface of the liver or spleen. The cancer has reached stage 4 when it spread beyond the abdomen into other parts of the body, such as the liver, lungs, bones, or in the lymph nodes in the groin. At Roswell Park, we have a highly experienced team of board-certified gynecologic oncologists who focus specifically on gynecological cancers. Know your body. Ovarian cancer whispers, so listen.
Use applicant in Ecuador. The whirlwind incidence is higher in women between 15 and 16 years old. 65 of diagnosed cases occur in women 55 years in 18 of women. The news is already advanced and presentation with a low 5-year survival rate. In conclusion, across an trial population, a regime of carboplatin, plaxi-traxers, and Veliparib induction therapy followed when we evaluate many times therapy led to significantly lower progression-free survival time. Carboplatin plus paclitaxel induction therapy alone. The independent value of adding Veliparib during induction therapy without Veliparib maintenance was less clear.
When we got the results of Forward 1, we reanalyzed all of the assay or all of the specimens using the PS2 by a blinded independent pathologist. So this is a very exploratory analysis, just trying to figure out what happened. And what we found in the distribution of patients who were enrolled, about a third were ineligible for Forward 1 because their folate receptor alpha was actually too low. And then among those patients who were classified as folate receptor alpha high by the 10x scoring, half of those were actually mediums. So our folate receptor alpha high subgroup, which was one of our primary endpoints, was actually diluted out by half by patients with folate receptor alpha medium. So then we reran the statistical analysis just on the folate receptor alpha high, which now is a much smaller population, so we've lost power. So this is purely exploratory. But when we do that and we look at the progression-free survival, it looks like the assumptions that we set forth in the study. The control's still 3.3 months, because why would that have changed? But the folate receptor alpha high group is now 5.6 months, and the p-value is 0.015. All of the secondary endpoints either are positive or trend towards positive, including overall survival, where our medians go from 11 to 16.5 months. That p-value is